Hello again, and welcome back to another edition of the Wiccan Conservative. Guys, I really didn't want to do this video at all. I think I've just been putting it off all morning because of how enraged I am with this situation, with the state of our country, and specifically with the topic of conversation regarding this pandemic. Okay, so what I have on your screen here is a transcript of the congressional hearing that took place on June 22nd between the health experts and the subcommittee, I'm guessing the subcommittee of Congress, who is overseeing the response to the coronavirus task force. Now, I don't want to read these slides verbatim to you. I think that I'm just going to talk a little bit about what's on the page and then scroll forward from there and try to tell you guys exactly what's going on when it comes down to what they're doing with this coronavirus nonsense. So first off, let me say that everything that the officials have said was going to happen with this virus has been wrong. All of their predictions on how it would behave, how it would affect our society, what type of numbers of a death toll we would be looking at is, when put into perspective to whether we were going to shelter in place or whether we were going to allow people out or not practice social distancing or what have you. Everything that they have said has been wrong. They've been bouncing back and forth on supposed facts, and this meeting obviously was no different, but to me it's setting up a bigger picture and it needs to be paid attention to. So of course, while the country is in total disarray, while we have American cities burning to the ground, domestic terrorism running rampant, talks about dismantling police forces and all this crazy things, we're concerned about this virus. We're concerned not only about this virus, but we're concerned with how we're going to vaccinate an entire population against this virus. So on your screen here is the beginnings of the transcript with a Frank Pallone Jr. I'm not exactly sure who that is. This is the first time that I've seen his name, but I really haven't been following up with the coronavirus experts since everything that they have said is wrong. So bear with me. You guys might know who he is. I don't. But if you read his text here, he is basically talking about, making a leadership role in the administration to take control or take charge of public health. And it says that our first consideration as we accelerate research into a vaccine and treatments, public health experts must ensure that it is safe. There must be, in effect, just prepare the supply chain with sufficient products necessary to administer a vaccine. So as we go through these slides, you'll see them talk about what type of actions can be taken when it comes to creating this vaccine. They're telling the public not to worry about how quickly they're rolling out this vaccine, because if you go back and read the entire transcripts, there are some questions that start to arise about how quickly this vaccine is becoming available to the public, when it will be available to the public, and how does it work, and so on and so forth. Now, again, they're discounting a lot of scientific methods that we used to use. I kind of really blocked all that out because it's just so far-fetched in my mind from what we were told the process of making a vaccine was to what the process of making this particular vaccine is going to be, and also the promise of eliminating or eradicating this disease once this vaccine is made available. So on the next slide here, we have Anthony Fauci, and he is talking about supplies for frontline workers and others through the economy, telling, apparently the other governors are telling him that we are still far from where we need to be. And the House has passed this HEROES Act, which I've been telling you guys about on my social media page that you should be writing. I wrote my senators every day and never got a response for at least 30 days. I've wrote them not to pass this HEROES Act and to act out against this HEROES Act, but apparently that is still in the works. And bringing mandates to prepare development of a contract tracing plan to provide $75 billion to carry out. So they want, again, to throw more money into this tracing program. And I also posted this on my social media. It is on Google now, that if you have your Bluetooth turned on your phone, it will signal around other phones and it will tell you who has checked in for having the coronavirus, or if you're in or around an area where the coronavirus was reported to have been. So again, we have them, mind you, the country is burning. There are domestic terrorists taking over cities in America. We're disbanding police forces. We're fighting a race war. And we're talking about shelling out even more money that doesn't exist in our government to provide a contact tracing program to track the virus that they want to eliminate with this vaccine. So right off the bat, I'm confused. If we are going to eradicate this disease I'm pretty sure that they come down to the conclusion by January 2021, we will have a vaccine. Why are we shelling out all this money for a contact tracing program to track where this virus could potentially be and how dangerous it could be? So Frank Pallone comes back and says they'll be able to receive government treatment of drugs and vaccines area. This legislation is needed. The Senate has failed to act, and the Trump administration has not put forward a policy vision. There is difficult work to be done to prevent further destruction. So this is now where the conversation starts to take a little bit of a turn, and I believe that they're setting up for the next impeachment narrative, and we'll go on through that as we continue on here. So it says this weekend, outbreaks have flared up and public health leaders have urged social distancing. The president put Americans at risk, in my opinion, by holding a political rally in Oklahoma suggesting staff to slow down testing to mask the true infection rate. The president said this morning he was not kidding. I believe this was reckless, and it continues to be the pattern of ignoring the advice of public health experts. Okay, so again, as I said at the beginning of this video, the public health experts have been wrong on every front. At this stage of the game, if you're not ignoring the experts, then I consider you quite foolish and uneducated, because everything that they have suggested to you has been wrong. And every action that they have taken, as in Cuomo in New York, in putting coronavirus patients back into nursing homes, has been the bulk of the deaths. The ones who decided that they, were going to go along with this social distancing and they were going to run the country according to how the health experts suggested, have now proven themselves to have the incorrect response to this virus and have actually accounted for a majority of the deaths due to the coronavirus. But let's continue. How Trump and his rallies destroy the social distancing and how they're causing the flare up because he had a rally. Not because half the country is burning and in turmoil and we have all different types of disarray going on. It's Trump rallies that caused the flare up. But I continue. Colleagues in Citizen Brooks to modernize the Pandemic Hazard Preparedness Act, the 21st century jurors legislation that even with all of that work, COVID-19 hit the world like a tsunami, quick, deadly, leading disruption. Our speakers are the co-captains of America's rescue plane that we are building while we fly. Congress has supported those efforts with funding resources and lets ability Trump stop flights from China and then Europe, typing in the border, and designated a task force that required executive authority, rarely used, including the Stafford Act and the Defense Production Act, harnessing American innovation through project like Operation Warp. So this is Bobby Rush, and it seems to me that he is, kind of reiterating the point that we're all saying. If all the countries got hit with this blindsided, we didn't know that this was going to happen. We didn't know what was happening in China, that, we can only prepare for what we know is going to happen. And as I said before, and I will reiterate consistently through this video, that all the information that they gave to us was false. And personally, I think that what they did was try to set Trump up to look like a dictator. And when he refused to take the bait and decided to allow the states, the sovereign jurisdiction, to do what they wanted with their population, that they had to double down and come up with a new narrative. And they were also slapped in the face when, through the innovation of people here in America, people who heard that the supply was wiped out, people that knew that we were going to need these supplies, once they stepped in and started making those supplies, and we became ingenuitous in our response to how would we protect ourselves from this virus, it put a big damper on everybody's plans, because again, the death tolls had to be inflated in order for us to be in sheer mass panic and to continue shutting down our own livelihoods and shutting down our own businesses of our own volition, since the president himself does not have the power to mandate that, nor do any of the governors or local officials, might I add. But I digress. Let's continue on. Through this response, the administration had to operate with conflicting data. Even with the CDC guidance in hand, some governors chose to ignore that guidance and force nursing home patients back into nursing homes, committing the deadliest mistake of the pandemic. So, as I said before, there were people who actually ignored real data that was coming in, not the fake data that they had predicted, but ignored the real data that was coming in and made the most costly mistakes. Yet here we are trying to turn this around and make it a public safety issue against Trump. But it gets better. So, the threat response with the resources that Congress has provided, data monitors, nation is underway, monitorization is underway. I do apologize. These transcripts are, as you can see, the disclosure at the bottom, compiled from uncorrected closed captioning. So if it sounds like I'm stuttering over words, that's how it's typed, but I apologize. So this is just stating that, again, they want to strengthen this task force. They want to, again, continue monitoring its citizens, continue spying on you and your personal health records. So when you go out and you get tested for coronavirus and you put in your address, where you live, how many children you might have, I don't know what they're going to ask you. I'm not getting tested. So I'm just assuming that these are the questions that are going to be on the questionnaire that is going to go into this task force, that is going to eventually put more of your sensitive data at risk than just the fact that there's somebody with coronavirus in your vicinity. But I digress. The CDC has begun to prepare months ahead, and when the next season's influenza illness will occur simultaneously, potentially with COVID-19, increasing the challenges on hospitals, healthcare professionals, and the public before seasonal circulation of the influenza increases. I encourage the American people to be prepared and embrace flu vaccination with confidence. This act will save lives. So again, this is now not coming down to something like, do you want this vaccine? Do you want to take a flu vaccine? We are coming down to the point where if you're tracked and traced and found to be in an area around an outbreak, what are you going to do? Are you now going to try to force a vaccine upon the citizens, because that's what it sounds like to me. And going through this transcript, the more and more it sounded like you want to pass acts that people must be mandatory vaccinated. You want to pass legislation that gives out these vaccines for free, so that people who would have the excuse like, I don't have the money or I don't have healthcare insurance to get these vaccines, would encourage them to, like sheep to the slaughter, go and get your vaccine like a good citizen. Let's continue on. Although you can never guarantee the safety and efficiency of a vaccine until you've actually tested it in the field, we feel cautiously optimistic, which is a catchphrase that is consistent throughout these transcripts. They are cautiously optimistic based on the concerted effort and the fact that we are taking financial risks, not risks to safety. So basically what they're saying is we're just going to throw money at this problem, and as long as we put in enough funding, everything will be safe. Guys, don't worry about it. Everything will be safe because they're spending enough money to keep you safe, and that's all you have to do is throw money at this virus and you'll be safe. Stay home, collect your government checks, and put your tax dollars and your grandchildren and their children into debt to the government, and you'll be safe. So not risks to the integrity of science, but financial risk to be able to be ahead of the game, so that when, and I believe it will be when and not if, we get favorable candidates with good results, we will be able to make them available to the American public. As I said months ago, it would put us at the end of the calendar year, and believe it will be when and not if. It'll be at the end of the calendar year and the beginning of 2021. So they acknowledge that other vaccines have taken longer trial periods to get through the process to become an FDA approved vaccination. But this one, they're going to spend the extra money so we don't have to go through all those trials and tribulations. We're going to make good candidates come to these facilities, take these untested drugs, these untested vaccines, and they're going to make sure that it's available for you at the beginning of 2021. Okay. Also, going through these transcripts, it becomes apparent that once this vaccine is out and people are taking it and they get to vaccinate the entire public, once this vaccine is out, this disease will go away. This disease will no longer exist anymore. Let me ask you, how many diseases have been eradicated from the face of this planet due to a vaccine? I can't think of one. We still have measles, mumps, rubella, scarlet fever. You have traces of the bubonic plague were actually found in rat feces in California. What is it, a year ago, 2 years ago, when they found that people were defecating in the streets out there. So tell me, if anybody can tell me, what disease exists that has been eradicated from the face of the planet, not just the United States, not just third world countries, not here, not there, from the entire world. What disease has been eradicated from a disease? Because apparently this disease can be eradicated with a vaccine. That's all, and it's only going to take a year, guys. How amazing is that? I mean, we shouldn't be questioning this. We should be excited about this, right? Okay, well, let's find out more about how they plan on making that vaccine, okay? So today I am pleased to announce the selection of Morehouse School of Medicine for a financial initiative. This agreement with the Office of the Assistant Secretary for Health, the Office of Minority Health, and the School of Medicine will implement a strategic plan of national, territorial, tribal information to bring to those hardest hit. The Morehouse School of Medicine will receive $50 million in this massive expansion of testing, created unprecedented demand to meet the demand we secured. Of testing created unprecedented demand. To meet the demand, we secured the global supply chain through a military bridge. We work with the manufacturers to increase domestic production, collaborated with external partners to validate new technology, secured and prioritized care points, test for a state laboratories, the Indian Health Service, and other needs. Finally, we use the Title III to further invest domestic, any fracturing. These have enabled our current efforts of states, territories, and tribes to implement surveillance plans. I would like to close by recognizing my fellow officers in the United States Public Health Service. So this is how they're getting the information to create these vaccines. They're monitoring you. They're paying attention to what you're doing. They've got everybody on board, and they're going to throw $50 million, the Morehouse School of Medicine, and they're gonna all come up with this vaccine. Sounds amazing. It's amazing, guys. We're on the verge here of a scientific breakthrough. This is amazing stuff. Mr. Anthony Fauci, Review and Development Program, and we continue to work night and day to provide guidance and review proposals from companies, scientists, and researchers. Let me be clear. That data and science will dictate when we have safe and effective treatments and vaccines for COVID-19. It says COVID-19, but I'm pretty sure it's COVID-19. We have not lost sight of our solemn responsibility to the American people to ensure decisions related to all medical products are based on science and data. Based on science and data? That's awesome. Well, then I guess we would be talking about the antibody studies, and we would be talking about the hydroxychloroquine, right? Okay, that's what we assume, that this is going to happen. Okay, let's go on. We will move to member questions. Each member will have 5 minutes to ask questions. I will start by recognizing myself for 5 minutes. You know, I'm very critical of the president for lack of leadership from the start of this pandemic, which I think continues. It is difficult because you work in theory for the president, and I feel many of you on many occasions actually wanted to take more leadership and be a commissioner. Han mentioned the cognizant of the data. I'm going to issue questions about the president's lack of leadership, and it is hard for you to answer. I believe the president is encouraging behaviors that are not consistent with good public health, such as encouraging thousands to attend a rally and not mandate the wearing of masks. Okay, stop. So we started talking about how we were going to start throwing all this money and how we were going to take care of these vaccines, and you know, we're going to start these questions, and here's how we're going to start our questions. And then we draw it back to Trump. Again, I'm not exactly sure if you know how much power the President of the United States actually wields as far as restricting the free movement of the citizens of America, but it's not that much. They don't hold any more power than basically you or I hold against another person's will to move freely about the country and or be in control of their own health and welfare. But I digress. Somehow, some way, this is all Trump's fault for having a rally, which, again, didn't even happen until the second wave of this coronavirus. So I'm really curious as to how this rally fits into this particular meeting, other than it being a setup to another impeachment hoax. But let's go on. Maybe they explain further. Give us an untarnished view of where we are in our fight against COVID-19. Thank you for that question. It really is a mixed bag. We have a very large country. Major differences between the New York metropolitan area and Casper, Wyoming. We have been hit badly. Anybody who looks at the numbers, we have over 120,000 deaths in 2.5 million infections. Okay, but they've already admitted that they've inflated that number. They've already admitted that isn't an actual number. And 2.5 million infections. What is the test rate now? What is the probability of a false positive on a COVID test? I know that we've gotten better, and I really kind of put all this down because I've really been focused on the real issues here in America tearing at our fabric of society. So I don't know anymore. But the last time I checked, it was like what, a 25%, a quarter of a rate of a false positive showing up on a test. So again, when you tell me that these numbers are inflated, and then you throw this obscenely large number of positive infections at me, I'm not supposed to question that. I'm not supposed to ask, hey, wait a second. What's actual numbers here? Have you adjusted for this and the third? Have you taken the time to go through those numbers and through that data? Because again, we still aren't seeing overwhelmed hospitals. I still haven't seen any bodies in the streets. And as far as Chaz is concerned, I know a lot of those people in Chaz aren't wearing masks. And if they are asymptomatic carriers, why aren't bodies coming out of Chaz due to COVID? Why are they coming out with gunshot wounds? I'm confused. I'm confused. So maybe they'll explain. Okay. In other areas, we are seeing a disturbing surge of infections that looks like it is a combination. One of these things is increasing community spread, and that is something I'm quite concerned about. You know, this has been something in the press over the past couple days. We're going down from 30,000 to 25,000. The way you address that is you have to have the manpower, the system, the testing to identify, isolate, and contact trace in an effective way so that when you see those increases, you can understand where they are coming from and you could do something about them. So without coming out and saying that because we're testing more and we're getting more people to test due to this contract tracing program, and that's where this increase in numbers is coming from, even though the death toll remains on the decline, instead of coming out and saying that, we've got to twist it into all these fancy words. We've got to twist it into all these fancy words, okay? The biggest limitation are the national data infrastructure we need. I'm calling up to 100 hospitals a day trying to understand who has a ventilator, how much you have left, and we got through this not by systems, but by people working 24/7. I'm going to pound the vaccine infrastructure into this country. That is one of the most disturbing things, and given the last couple circumstances that have come up in the news. For me to say that right now, I'm going to pound the vaccine infrastructure into this country. That is so disturbing. So without saying anything more, if you just heard that particular phrase, would you feel that they're out for, anything less than 100% vaccination, 100% compliance with a vaccination? Because I can't come to any other conclusion from that statement. That we order enough flu vaccines because we need to get everybody vaccinated this winter. I don't have to guess. I don't have to guess what that statement means. I can read it in his next sentence. I can read it in his next statement. That minimizes problems is one less virus that could kill 50,000 to 70,000 people. Okay, that's it. That's all you guys got to do. That's all you got to do. Just walk in and get your vaccine. And then rat on all your friends and family and everybody that you've come in contact to or contact with up until this point. That's all you have to do. That's all you have to do. Not a big deal, right? So here we go again. Robert Redfield. I love the focus in this. I love the focus in this meeting. I love the focus. Now, not only is it Trump's fault, but the virus, it's racist. It's racist, guys. The virus is racist. It can tell your skin color. It can't tell you how it acts in the body or how to stop it, anything like, but it could tell your skin color. So 44 black men and women have died from the coronavirus at 97% the rate of white Americans pick up. Dr. Fauci, when did it become apparent institutional racism were playing a part in why certain racial and ethnic communities are suffering more than white communities? It says what communities, but I assume it says white communities, and that is another misconstrued closed caption. So, you mean to tell me that institutionalized racism is the driving factor behind why this virus is killing black people? It's not because they don't, they don't have underlying conditions. It's not because of their lifestyles. It's not because of their personal choices. That has nothing to do with it. No, it's just the color of their skin, guys. It's an institutional racism. This was made by the white man. Again, just another shot at black America. That's what this is, guys. And just the fact that it's affecting white people as well, that's just, an error in design. We made it good, but we didn't make it that good, according to Robert Redfield. They are suffering disproportionately. One is the risk of infection because of economic and other considerations. The jobs the majority of them would find themselves does not allow them to protect themselves by looking into a computer and doing telework. Most of them are essential workers. Oh, okay. I get it now. That's what it is, because of lifestyle choices that these people have made. That's the institutional racism. That's it. Silly me. We know from a lot of experience now the situation regarding whether or not you have serious consequences, hospitalizations, and the patient's complications and deaths relate strongly to underlying conditions which are clearly disproportionate in the African American community through no fault of their own because of underlying conditions. Okay, so again, yes, people are comprised and composed of different biological materials based on your genetics that you get from your family line, passed down from century over century over century over century. Apparently, that's institutionalized racism and disproportionate health issues that were issued specifically to black people. White people did that just so that the black man would have one more obstacle to overcome, according to Robert Redfield. Dr. Fauci, would you consider racism itself as being one of the factors that negatively impacts African American communities? Interesting. I thought this was supposed to be about COVID, not racism. But here we are, yet again. Let's create this narrative. Let's make another reason for the black man to revolt. It's bad enough that we're fighting over whether or not we wear masks. You can mob somebody for not wearing a mask. You can mob somebody because they're for the police system. You can do all these things. Now it's completely acceptable to be upset and enraged that you might possibly get coronavirus when being black. Sorry. Okay, these are just words that are written from the transcripts. I'm just repeating. That is a haunting question. And so while we were doing the nice back and forth this morning, good questions on the part of the members, I really remain dismayed and deeply disappointed. We need leadership coming out of the CDC. Real leadership. There was an outrage. There was a gathering in Tulsa. Six of the president's people were infected. And it is my understanding 2 Secret Service agents were, how can the CDC allow this pandemic, this virus, to be something political? You have to push back. You are a scientist. You are a doctor. I am sure you read several articles regarding the hydroxychloroquine. Okay, so again, we're bouncing back and forth. Now, not only is it racist, but it's the president's fault. He even endangered his own people. He's so racist. He's so racist, he got this virus to disproportionately affect the black community and infected his own staff. Now, when it comes down to the hydroxychloroquine, guys, you guys have read the studies, not done here by the CDC, but done by France and other countries that have proven what these people are about to say wrong. Hydroxychloroquine in every study says it does not work in any setting. Interesting. That's super interesting because I've read 3 different studies that are completely contradictory to that statement. In fact, it has known side effects of cardiac issues being one. There is danger in terms of side effects. As commissioner, you see all of the data. Are you going to inform the American people, doctors across the country, about these facts? Really interesting. It has all these negative side effects, yet we've been prescribing this drug for how long? 3 decades? 4 decades? And it's still being prescribed, but only in the case of COVID. Only in the case of COVID will you get these derogatory side effects. Thank you for the question, Congresswoman. Indeed, we are. I can refer the committee to several documents we have put out over the last several weeks regarding hydroxychloroquine. We issued a safety alert, particularly around the combination with other drugs that might affect the heart. As you know, we have taken recent action regarding. Okay, you're right. Combinations of drugs have a different effect than just taking one prescribed medication. Here's a good example. You can't drink and take a sedative. If you're taking an opioid, you probably shouldn't be drinking alcohol. Mixing drugs. You're mixing your drugs and your alcohol. If you're on an antibiotic, it negates a birth control. Again, you're mixing 2 different drugs. That is not what the congresswoman or man, whoever it was, that's not what they asked. That is not what they asked. But yet again, here we are clarifying for our leaders, for our representatives, for the people who are asking these questions for the health and safety of the American people. A piece by me directly to the American people. I want to know if you have spoken out verbally to the American people and doctors across the country. People don't read papers, with all due respect. Every opportunity I have been in the media, I have been asked to answer that question. Okay, so again, he's been out there, he's been talking. Apparently, you can't read. Congress thinks you're stupid. You can't read. You don't know how to go out and get your information. So somebody's got to spoon feed you your information. They got to tell you, here, this is good, take your medicine. All right, guys, this is what your leadership, this is what your representatives think of you. This is what they think of you. Dr. Redfield, when a vaccine or treatment is developed, how will it be distributed to Americans? It is a critical issue that currently under discussion within the team to look at what the appropriate prioritization for distribution is, okay? So now they're telling you, okay, well, we know that it disproportionately affects the black community. We know that this is systematically racist. So once these vaccines come out, we're going to prioritize the distribution of these vaccines. So, Black America, what do you think that means? that means you're the first guinea pigs. That means you guys are the ones who are going to get these vaccines. You're not going to pay for them, so I guess there's that. But you guys are going to be the ones getting them first. They're telling me they're going to prioritize. I'm not a priority. I'm not a high-risk case. I don't have any underlying conditions, and I obviously ain't the right skin tone. So you guys are going to be the guinea pigs. I'm just saying. There are serious considerations to try and develop those prioritization, and it is going to be important to develop them dependent on the product. Thank you for all your work, and thank you for taking my calls on Friday and Saturday nights. I appreciate it. The FDA run. To go to Mr. Doyle, coming from Pittsburgh. Mr. Doyle. Mr. Chairman, I forgot to unmute. You are recognized for 5 minutes. Thank you for holding the hearing, and thank you for your service on behalf of the American people. This continues to conduct oversight of the Trump administration's shortcomings related to procuring and distribute and personal protective equipment, PPE. Hospitals were faced with critical shortages of PPE such as masks and gowns. President Trump said the federal government was not a shipping clerk. We saw the failure of leadership. Without a national strategy, people had to defend for themselves and compete against each other for critical supplies. Okay. What's your point? I'm confused. You're throwing all this money at the CDC. Why didn't the CDC come up with the gowns and the masks and the equipment? They're the health experts, right? Why does it fall on President Trump? I'm confused. You said that you guys knew that this was coming. You said that you guys knew that you were going to need this equipment. You guys knew that this was going to be a problem. But you're telling, you didn't have the supplies, so Trump couldn't even distribute the supplies if he wanted to distribute the supplies. But that's right. That's racist. I forgot. That's racist. That is right. We didn't have the supplies to begin with, so Trump couldn't distribute the supplies, and the CDC isn't responsible for coming up with making the supplies. I guess the president should have done it himself. He should be out there working on getting masks and gowns to hospitals that didn't need it. What happened to all those field hospitals that they put up? How many patients did they see? How much money was wasted for those hospitals? How many people have stopped going to the hospital to the point where they had to lay off employees? We didn't talk about that in this hearing. We haven't talked about that. No, we talked about racism, though. We talked about how it's President Trump's fault, and we talked about how we want to monitor our citizens and force them to get a vaccine. But we still aren't talking about what is actually happening when it comes down to this particular virus. Who it affects, why it affects them, and what we're doing to prevent it from happening to the susceptible population, the actual susceptible population. You know, all those old people in the nursing homes that passed away that created 65% of the death toll? Those people, black, white, Puerto Rican, Asians, those people. Let's talk about those people. Because this whole thing, this whole lockdown was so we didn't kill grandma. We aren't talking about grandma. We aren't talking about grandma. At a recent hearing before the Oversight Investigation Subcommittee, the governor testified the lack of centralized coordination at the federal level of competition between states and federal governments to procure limited supplies, driving up prices and exacerbating existing shortages. Okay, again, why were the federal supplies so low? If everybody knew about this, because that was the next talking point prior to this second wave, when we went on lockdown, President Trump had ample time. He had ample time. We told him about this. When this was happening in China, we told him about this. So again, I ask you, I ask you, what do you really think the federal government is responsible for? They're not responsible for my health and safety. They're not responsible for my personal welfare and well-being. They're not responsible for paying my bills. But somehow, some way, these medical professionals seem to know how our federalized government should work. And the Congress is buying into that. The people on this subcommittee, this hearing committee, they're the ones who want to brainwash the American citizens into looking at the federal government for all their needs, for all their wants. Don't worry about it, guys. You shouldn't be responsible for your health. We'll be responsible for your health. Don't worry about that. You don't have to look for supplies. Look to the federal government. They have the supplies. I would do my best to answer. The Admiral is certainly running the supply chain, but being a member of the Unified Coordination Group for the past 3 months, I'm pretty familiar with this. I think we know that there was a shortage of everything when this started. Really? There was a shortage of everything before this started? Well, that's crazy. That's crazy. You know, I thought the president was warned about this. I thought you guys told him about this. So that would mean he had to have ignored it completely. Oh my God. That's terrible. That's terrible. Wait a second. You didn't know shit. Excuse my language. You didn't know. You didn't know. If you knew, then why didn't you tell the hospitals? If you knew and the president wasn't acting, why didn't you say anything before this became a pandemic? The media should have been all over that. It would have ran 24 hours a day, 7 days a week on every news feed that it could possibly run on. Right? Because that would have been an in the moment, aha, I got you, to the president, wouldn't it? Unless, of course, you're telling me that the media wasn't interested. I find that hard to believe. I find that hard to believe. We should have 180 million per month produced domestically by that time. They're talking about masks. Masks being produced domestically. Not shipped in from foreign countries, not on backstock, not ordered from here, there. Produced here domestically, again, by those ingenuitous Americans who decide to shut down their personal factories and take up some sort of cause for the greater good. This was not available when we started in March. The industry was not here. This was all offshore between March 1st and June 19th. Wow. It's only like the 24th, isn't it? This hearing is on the 22nd. So up until June 19th, it took us that long to get supplies? Funny. That's super funny because I see a lot of people out there wearing masks. They're not N95. They're not the hospital grades. But again, they're out there. They have their bandanas. I see people producing their own. But it was all offshore between March and June 19th. The industry wasn't here. Okay. If you say so. If you say so. We talked with governors in every state. Many states are doing their own supplies for 60 or 90 days. I'm confident that from here on, as we ramped a mastic factory, not exactly sure what that means, the country where we have recommended all residents get tested so we could start with a clean baseline of understanding where the pandemic is. I will end with, though they only make a 0.6% of our population, nursing home residents have made up more than 35% of our mortality. 35%. That's what they're claiming. That's what they're claiming, 35%. I've heard as high as 65%. I've heard as high as 65%, and those are people who have attempted to adjust the inflated numbers that were coming out of the CDC. Okay, so again, we needed these masks that weren't being produced, that weren't in stock, that should have been in stock because everybody knew about it and told the president about it, but nobody acted on it. Nobody took precautions for it. But we still aren't seeing the death rate that they claimed that we would see in the beginning, also taking into consideration social distancing. But we're the crazy ones. We're the ones who don't know what's going on. We're the ones who have this twisted, warped sense of reality, that we don't understand science. We don't understand the words. We're not even smart enough to pick up a paper and start doing our own research. What are we doing? This is what you're worried about? There are actually people who had no underlying health conditions, who were free members of this country, dying. You had 60 people dead in Chicago. 2 kids under the age of 6, I believe, were shot in a crossfire over Father's Day weekend. You have body bags coming out of Chaz, not from COVID, from what I assume are gunshot wounds or being beaten to death. You have people actually being beaten to death. They're mobbing each other. These are healthy people. These are people that were living their lives, unburdened by underlying health conditions, people who were in the prime of their lives, sometimes in very early stages of their lives. And you have this subcommittee in Congress talking to these health experts, telling you how stupid you are. You don't know what's best for yourself. Only they know what's best for you. Money can cure this disease. They're going to come up with a vaccine that eradicates it off the face of the planet. And all you have to do is comply. That's all you have to do. And if you don't comply, you're complicit in the systematic racism of this disease. That's what they're telling you. I highly encourage you to go read or watch. The entire process was a 5-hour hearing. It was a 5-hour hearing. I read through the transcripts because I could not take listening to these people speak down upon the American people. I couldn't do it. And I figured it would be better to bring to you screenshots from the actual conversations. Don't take my word for it. Don't take my interpretation. Go read it for yourself. Tell me what they're telling you. Tell me how they feel about you and your intelligence level. Because to me, this isn't about health and public safety. This isn't about doing what's best to cure dangerous, deadly disease. This is propaganda in its highest form, coming from our elected officials. Again, I, for one, am tired of being talked down to like I've got no sense, that I don't know what's best for me and my family. Because I guarantee you that I do. I know better than the government knows. And I've got no problem working and taking chances and doing the American thing and living in liberty and not complying to slavery. Because ultimately, if you rely upon somebody else for your health and your safety and your well-being and your happiness, you're a slave. That's what you are. I'm sorry to break it to you like that. I'm also sorry that I swore, because I try really hard to keep my emotions in check in these videos. But I woke up today completely disgusted with the state of this country, the focus. What are we doing? It's time. It's time. It's time to stop this nonsense. It's time to be united again. We went from we're all in this together to pitting Americans against each other in the name of safety and well-being. My local high school that my kids are going to go to next year come out and said, you know, one of our teammates, one of the student athletes has come down with the coronavirus. You wouldn't believe the outrage from these parents and how scared they are because of the misinformation and propaganda on their television set 24 hours a day, 7 days a week. It's insane. Guys, you got to start going out. You got to start living your lives. You've got to start comparing your perception of reality to reality. What you think it is, this is over here. What it actually is, this is over here. You're not going to learn what it actually is until you go out and experience life. I want you to go out and I want you to live. I want you to have your own experiences. Excuse me, then come home and reflect upon what you thought and what actually happened. I guarantee you, your perceptions of reality will be shattered. Go into the world with an open mind. Keep your heart open. Project positivity. You might be surprised with the results. That's all I have for you guys today. I hope you like this video. Don't forget, subscribe and share. And I will catch you guys on the next one.